So what I'm interpreting here is that this is a byproduct of capitalism in a sense. We have a free, I mean, not that there's anything wrong with capitalism, but the free market allows food industry to push unhealthy foods in front of us, but it doesn't matter because as long as they sell them. And by the way, there's regulations that I thought were supposed to protect us. And that's where I come across your work. And I'm once again blown away that even industries like, or, agencies like the FDA and the Department of Agriculture, what are they just missing the mark here, or what's going on?
They're captured. I laughed when you said the word capitalism because I used to call it the C word. Whenever I gave talks about nutrition or wrote books, I never mentioned the word because it made people really uncomfortable. Now everybody's talking about it. I think our understanding of the economic forces behind our food supply and our food system are much better now. I mean, if the COVID pandemic did any good whatsoever, it was to lay out for people how the food system worked and doesn't work, and why late stage capitalism is so bad for public health. I mean, I think people really understand it now. And the agencies are captured by corporations. I'm just writing a piece right now for my blog. I write a daily blog during the week, foodpolitics.com, and I'm writing a piece on user fees for, there was a big article in the New York Times about drug industry user fees, where the drug industry pays the FDA to evaluate drugs. I mean, I can't even say it with a straight face. The drug industry pays the FDA to evaluate whether a drug is safe and efficacious. And I mean, I'm just sort of left breathless by that, because that is an inherent conflict of interest. It puts the FDA in an extremely awkward position of having to get its money from the companies that it's evaluating. That just doesn't work. We're human. We have feelings and emotions, and this just doesn't work. And so I was once on a FDA food advisory committee, and in my very first meeting, this was actually the FDA science board, and at the very first meeting, they raised the subject of food industry user fees, and I was just appalled. I said, that's a conflict of interest. And they said, but NIH does it. And I said, but NIH isn't a regulatory agency, the FDA is.
And user fee, really quick, if I can interject, user fees, is that them paying the agency to approve labels?
Yeah, to approve the drug or the product or the safety or any of those things. I mean, it just doesn't make any sense at all. And that's because the FDA is an enormously underfunded agency. But you look at a lot of the decisions that the agency has made over the last few years, and it's explained by the fact that it's paid for by the drug industry. 3/4 of its budget for drugs comes from the drug industry.
Corporate interests.
Yeah, so that's a conflict of interest, and the FDA has always represented big agriculture, so there's nothing new about that. And these are agencies that are, I don't know, they're in bed with the companies that they're supposedly regulating.
And are we talking here about the meat industry, or big chicken, big beef, dairy?
Oh yeah. I mean, the Department of Agriculture represents big agriculture. It does very little for small farmers. It does some things because it's under pressure to do that. But it does very little for small farmers. And the Agriculture Department is not about food. I mean, one of the really bizarre things about it is it's about, it's not about, the kind of thing that you buy in grocery stores, except for meat and chicken. I mean, most of the funding for the Department of Agriculture goes to the growers of corn and soybeans, and that's feed for animals and fuel for automobiles. hardly anything that the Department of Agriculture supports is food for people, except indirectly through meat. And if there's one thing about meat is, we're supposed to be eating less of it because of climate change.